everyone, and welcome to our very first IHC podcast. My name is Wincy Hong, and I am the Communications Coordinator for Indian Health Center. I will be the host for today's program. Our guest today on the line is our Director of Development and Communications, Hera. Hera, would you like to introduce yourself?
Greetings all, my name is Gerardo Loera. I am the Director of Development and Communications for the Indian Health Center of Santa Clara Valley. I come from the Pueblo, Mescalero, Apache, and Pame peoples of New Mexico and Northeastern Mexico. And I'm super happy to be of service here at the Indian Health Center of Santa Clara Valley.
And thank you so much for making time to join us today for a conversation regarding so many different topics. 2022 was quite a big year for IHC. What have been some of the challenges and accomplishments that IHC has persisted through?
2022 certainly shaped up to be another challenging year as we continue to essentially address the unique challenges posed by the pandemic. It's continuing to pose new and challenging circumstances for our community, for our patients, for our staff, and certainly us as an agency overall. We continue to work through the challenges posed by COVID-19. This last year, we're excited to report that we transitioned over to a new electronic health record system, which is called Ocean Epic. The patient portal is called MyChart. This was a transition that we launched in conjunction with several of our FQHC or Federally Qualified Health Center partners in community in order to provide a more seamless continuum of care for the patients that we share, and especially the patients that we share in common. I would say finally, just because I'm focused on the challenges, it would probably be staffing. Staffing has also continued to be a huge priority for us at the Indian Health Center. So any of you out there who are healthcare professionals interested in healthcare, please take a look at our careers page on our website to learn a little bit more about the many opportunities with us. It certainly is one of our priorities to continue to provide opportunities to our community. As far as some of the accomplishments achieved this last year, while those challenges certainly do exist and we can't ignore them, we also get to celebrate the fact that, we had another stellar year continuing to provide comprehensive healthcare, medical, dental, counseling, WIC, nutrition, and prevention services to over 22,000 patients, while continuing to be the only healthcare provider in Santa Clara County that specializes in the unique healthcare needs of American Indians. Our prevention services are really directed at the portion of our mission that speaks about ensuring the survival and healing of our American Indian, Alaskan Native, and greater community. Really grateful to see that a lot of our programming going back to an in-person format, which has been a need really for our community at large. After having experienced the isolation, we are now learning how to better maintain our health in an in-person setting, and as such, a lot of our programming, everything from our prevention services, youth workforce development program, to our intertribal monthly gatherings, everything including movie nights, game nights, to our community wellness and outreach. For example, there are Two-Spirit support group on a monthly basis. Those things have all returned to an in-person format, and in some cases are provided in a hybrid setting, which has just been really good for us all around. I think our mental health and our own personal well-being has certainly been shored up by being able to be in touch with folks again in that way.
Thank you so much for such a comprehensive answer, Hera. You touched based on, some of the challenges definitely stem from the pandemic. Why do you believe that IHC was able to persevere through the many obstacles stemming from the pandemic?
I would say first and foremost would certainly be our commitment to the well-being of our community. Our staff that are committed to the work that we do each and every day at the Indian Health Center has a real affinity for our mission and for the patients that we serve. Again, we serve over 22,000 patients who are residents here in Santa Clara County and that represent the vast diversity of our county, while also being able to provide a space and services that are uniquely tailored to American Indians. I would say first and foremost, it's that commitment that our staff has towards supporting the well-being of our community. There's opportunities abound for folks who are working in the healthcare space. That being said, as a nonprofit, federally qualified health center, it's a real challenge for us to be able to compete with some of the salaries offered by private care providers. Yet our staff continue to show their commitment to the work that we do. An example of that, we recently hosted our Employee Milestone Awards in December. And we have staff that were celebrating their 25 and 30 plus years of working with the Indian Health Center as a continued demonstration of the commitment to the well-being of our community. And I would say that certainly is at the heart of how it is that we've been able to overcome the challenges of the pandemic.
Thank you so much for highlighting the amazing work that the staff does on a daily basis. All of our clinics, from Forest Avenue to Silver Creek to Meridian to O'Connor Family Medicine. I mean, the work that our staff does is selfless and just so incredibly inspirational. Any sort of words of encouragement for staff and for IHC patients / community members as we continue to persevere through this pandemic?
Please continue to have hope, patience, and understanding. This has been such a trying time for all of us as human beings, really throughout the world. I think we've all experienced a shift in the way that services are provided. I think a lot of us are learning how to be in person again. I mentioned some of the challenges that we've been taking on here at the Indian Health Center this past year, in particular, as we continue to navigate COVID-19 in order to improve the services that we provide and how we provide them. We transitioned to a new electronic health record system. That's been a huge lift for our agency. All of our staff, honestly, in every aspect of the work that we do, we've been impacted. And so just a huge thank you to our patients for continuing to maintain patience with us. We navigate the challenges so that we can continue to keep our doors open. And a huge thank you, of course, to our staff who continue to demonstrate a commitment to the work that we do. All of these circumstances, some self-imposed, like the transition to the new health record system, and those things that we absolutely have no control over, like the pandemic. We will get through these, and the only way that we can get through them in a good way is continuing to have hope and seeing beyond our immediate circumstances. Just hang in there, everyone. We are in this together.
Awesome. Thank you so much for your words of encouragement there. I had some conversations now about the staff that are at the front lines, working with our patients every single day this year, bringing in more attention as well to what our leadership is doing. What has been happening on the federal end for Native American advocacy and advanced appropriation that you can explain to our community members?
Yeah, for many of you out there who are familiar with us as a healthcare provider, the Indian Health Center of Santa Clara Valley, through the leadership of our CEO, Sonia Tetnowski, we are certainly considered to be at the forefront of advocacy, not only for healthcare on behalf of American Indians, but also the communities in which we live, the urban communities in which we live. I spoke previously about us being what they call an FQHC, a federally qualified health center, but in addition to that, our initial funding only came through the Indian Health Service, which is the federal arm that oversees essentially healthcare for American Indians, both on reservations and in urban settings. And so we are considered an urban Indian health. We are also at risk each year that the annual budget is being approved on the federal level of shutdowns. We are one of the only healthcare provider types that are essentially at risk of having to shut our doors due to gaps in funding. And so through the national advocacy led by our partners at the National Council of Urban Indian Health, or NACUI, for whom our CEO, Sonia Tetnowski, sits as the president of their board. Essentially, through their work, advanced appropriations were secured in order to ensure that healthcare providers through the Indian healthcare system would not be at risk of having their doors to be shut in the event of gaps in funding due to budget approval. And so that was a huge win for us this last year, and really grateful to the work that's being led by our partners, and certainly all of those participating. We belong to a network of 41 urban Indian healthcare providers in total throughout the nation. And together, our voices are being heard. The voices of the communities that we serve have been heard through the advocacy work of NACUI and so many others, those here in California at the California Consortium of Urban Indian Health, as well, working in tandem towards making sure that our doors remain open in this critical time, facing any kind of budgetary gaps. So really grateful for that.
CEO Sonia Tetnowski's recent CEO message in the January 2023 newsletter, she talks about, and I quote, "I am thrilled to share the exciting news that Congresswoman Zoe Lofgren's 15 Community Project Funding, or CPF, requests were included in the year-end omnibus that passed the House earlier this year. The bill is now headed to the president's desk to be signed into law." This sounds like definitely a very major accomplishment. And so could you tell us, the community members tuning in today, a bit more about the work being done by Representative Zoe Lofgren's congressional office in relation to IHC?
Yeah, this is actually very exciting news. For the first time ever, the Indian Health Center of Santa Clara Valley applied for these community project funds. The opportunity is presented on an annual basis. And so for the first time in our 45 years of existence, we actually submitted an application, and per Zoe's office, were included in what was to be signed by President Biden. And so that's very exciting. I believe that there are 13 projects in total that are being funded within her district, California District 19. The proposal that we submitted was specifically focused on supporting our American Indian, Alaskan Native, and greater community in their COVID-19 recovery. Our young people in particular are suffering in so many different ways. And American Indians throughout the nation per capita were hit harder than any other ethnic group. And as such, this funding right here will allow us to shore up our efforts to be supportive to our American Indian, Alaskan Native community and the communities in which we live. Our 4 sites essentially are all established within her district, and really grateful to the work that she continues to do to represent not only American Indian, Alaskan Natives, the community that we serve, but certainly all communities that are in need here in her district.
So thank you so much, Hedda, for sharing more in detail about what is going on the legislative end, and for all of the amazing work that Representative Zoe Lofgren's congressional office is doing for our community. And so with that, and also with the new year, what can community members, patients look forward to in 2023?
In order to keep ourselves, our homes, our families, and our community safe, we really do encourage everyone to be sure that you're fully vaccinated. So, vaccination, COVID-19 efforts continue to be a priority for us, while also being able to continue to provide all of the whole suite of services that we do here at the Indian Health Center, with 4 clinical sites and 7 supplemental sites throughout San Jose. As we say, Indian Health Center of Santa Clara Valley, where everyone is welcome. And what we mean by that is, well, anyone can come to us. You should be able to find a service that you have access to, regardless of insurance, regardless of ethnicity, regardless of racial background, sexual orientation, and even ability to pay. We offer medical, dental, counseling, WIC, nutrition services, and prevention services to the greater community as well. We have a produce mobile that is held in our downtown location at 602 East Santa Clara Street through our Community Wellness and Outreach Department. You can also access our gym with the approval of your primary care physician, whether that be with Indian Health Center or through another healthcare provider and community. That is another space where you can, regardless of your patient status, be able to access some of the wonderful services that we host here at the Indian Health Center. Our Intertribal Resource Department is continuing to host multiple events on a monthly basis in a community space that, regardless of your patient status, you can have access to, again, everything from movie nights, game nights, and cultural events like our seasonal gatherings. Those are open to anyone in our community. You can also find a suite of prevention services through our prevention service department, which is under our counseling. Regardless of your patient status, you are able to access those wonderful programs. And you can find all of this information, a little bit more about these things, and inclusive of the best person to contact for more information on our website. We take a holistic approach not only to healthcare within our agency and the members that we serve directly, but to the greater community. And that's exactly why it is that we open ourselves up to the greater community. In 1977, our agency was founded specifically to serve American Indians in this urban setting here in Santa Clara County. It is inherent to Indigenous culture essentially throughout the Americas. You can't only take care of one aspect of community without taking care of the greater community. And so that we take that approach here at the Indian Health Center of Santa Clara Valley very seriously. And so that's why not only do we continue to be the only healthcare provider specializing in the unique healthcare needs of American Indians and Alaskan Natives, but that why we open up our doors to the greater community so that we can, as a community, experience a better quality of life.
What would you say is IHC's vision for the next year?
I would say we continue to work towards equitable access to comprehensive healthcare with a smile for all.
Thank you so much to Hedda for all the work that you do as our Director of Development and Communications, making sure that IHC services are visible and highlighted in our community. So I just want to give a very warm thank you to Hedda for joining us today, and for our community listening. To stay updated with IHC on the plethora of programs that we have, as well as information to schedule appointments for care, you can check out our website at www.indianhealthcenter.org. Again, that is www.indianhealthcenter.org. Thank you for tuning in today, and we will be back next month. Stay tuned for more. Bye now.